Hello everyone, I am Dr. Nagraj Shetty. I am a consultant arthroscopy, complex knee surgeon and shoulder surgeon practicing in the city of Mumbai with more than 16 years of experience, and today I am at Nexus Day Surgery Centre. Today we are going to discuss about a very common problem, that is ankle pain and ankle instability. Let's start off with discussion about ankle pain. It's become very common in our practice now to see patients coming with ankle pain because of their increased level of activity like marathon running, like involved in trekking and mountaineering, involved in sports and dancing. With these increased activity, we are seeing that the patients are coming with some common ankle pain conditions. The first condition I'd like to discuss is what we call as ankle impingement. Now, the ankle can be divided into the front of the ankle and the back of the ankle. So, therefore, the painful conditions are again divided as those arising from the front of the ankle. So, let's talk about that first. So, like in this image you see, this is the ankle joint X-ray, this is the front of the ankle and this is the back of the ankle. So, what happens because of repeated high level impact activity, these two bones start pinching on each other and there can be excessive growth of bone, which we call as impingement. We try to manage this with medicines, with activity modification, with some braces initially, but sometimes we have noticed that this bone growth becomes so severe that the patients start experiencing repeated painful episodes and swelling episodes. In those cases, we make sure that the patient gets relieved with some minimally invasive procedures wherein we excise this extra bone, and this being a very minimally invasive surgery, the patient is not needed to stay in the hospital for more than a day. He can even go back on the same day and get back to action within a few days. So, that is the front of the ankle, and we just discussed about anterior ankle impingement. The second condition which we need to discuss in the front of the ankle is usually after a minor twisting episode, and these lesions are what we call as osteochondral lesions. They can also happen in patients who have got a weakness of their cartilage condition called as osteochondritis dissecans. Cartilage is the cover of the bone, and the ankle cartilage is also susceptible to injury and to problems like the cartilage of the knee, and this is what we call as the osteochondritis dissecans or osteochondral lesions of the ankle. So, now as we see in this image, this is the ankle bone called as the talus. The cartilage, when it is normal, is smooth, and when it is damaged, it becomes irregular and sometimes there develops a defect. So, this defect is what we call as an osteochondral lesion. Like I mentioned, this can be secondary to an injury or it could be secondary to a condition called as osteochondritis dissecans. When the lesion is small, we are able to manage this by a procedure which is anterior ankle arthroscopy, and we do a abrasion chondroplasty. So, we abrade the whole tissue and drill holes into this defect so that fresh blood circulation comes from within and covers up that defect with fibrocartilage. This again is a minimally invasive procedure, a day care procedure. Patient needs to undergo some rehab for a few weeks and they can have full recovery. Having completed the important conditions in the front of the ankle, let's also discuss the conditions in the back of the ankle. So, this is the ankle X-ray and we are looking at it from sideways, and the back of the ankle, again like we discussed in anterior ankle impingement, you can develop posterior ankle impingement because of some extra growth of bone in this area. This also can be managed with minimally invasive procedures called as hindfoot endoscopy. So, it is a keyhole surgery which involves removal of this bony spurs, and the patient can be back in action very early. One of the very common conditions which patient present with is heel pain, back of the heel. So, there are various conditions like retrocalcaneal bursitis and insertional tendo-Achilles tendinopathies. So, this is an X-ray of a patient who has an insertional tendo-Achilles tendinopathy. You can see that there is an extra calcification and deposition of calcium in the area of the insertion of the tendo-Achilles, and these can be very painful. They have to be differentiated from retrocalcaneal bursitis and from tendo-Achilles tendinosis itself. Once it is differentiated, we try to manage it with conservative modalities, and when it is very severe, we need to go ahead and excise this particular lesion. Because this lesion is in the area of the insertion of the tendo-Achilles, we need to repair the tendo-Achilles also once this excision has been done. So this covers about insertional tendo-Achilles tendinopathy. We also have a condition called as retrocalcaneal bursitis, which is slightly upper area here the pain will be, and this can be secondary to some bony prominence here called as a Hagelin deformity, in which case we can do an endoscopic retrocalcaneal bursitis excision and calcaneoplasty, which is again a minimally invasive procedure to take care of these sort of ankle pains. So in summary, painful conditions of the ankle can be divided as those from the front of the ankle and the back of the ankle. Almost always we try to manage them with rest, bracing and conservative measures. However, when it is very severe, these minimally invasive endoscopic and arthroscopic procedures provide excellent relief to the patients and back to their routine activities in a short duration of time.